So in this instructional video for this Cybex trunk rotation machine, I'm going to go over all of the execution essentials and apply them specifically to this machine. So this video will be good for you to review. Anytime you've been doing this machine for a while, maybe you feel like you're starting to lose some of the ideas, just review all of these things I'm going to go over. So I'll show you how to do this appropriately and accurately, and then give you some of the common kind of misconceptions that I see people doing on this and the mistakes they might be making. So we've got the weight in the place it needs to be. I've checked my setup on the machine in terms of where the seat should be and where the knob should be. Those are the first things. Then making sure that we continue with the setup and get ourselves set up properly in the machine. So you can see how I get the machine kind of into the middle with the point of this input arm pointing straight ahead towards this cable in the middle, getting my chest nice and locked in so it's not, rounded shoulders pushing on the machine. I'm getting my chest pulled straight into the machine with these handles. Now I'm set up properly on the machine. Now I initiate the movement by engaging my core and my obliques, and my intention is to spin my rib cage inside of my body on top of my fixed pelvis. So I'm not just trying to spin the machine, which means I could use my hands or anything else possibly to move it. I'm keeping myself set up in that same position, and then I'm intending to move the machine by moving my body and twisting my rib cage. So often what I see on this is if you watch my pelvis back here, people will twist and their pelvis kind of flies backwards this way, so their leg sort of slides back. That's what we want to avoid. So we want to make sure that we're trying to keep our pelvis forward and push our leg into this pad. Now, one of the things that people often do to accomplish pushing their leg into the pad is they push down through their foot and then just push their leg in, so it's more of this kind of idea. You can see that more by knee pushing in versus trying to keep my whole pelvis fixed forward with my leg pushing into the pad. So the way that would look if done correctly is I'm all set up. I initiate with my core, my obliques and my abs, and then I try to keep this pushing forward as I twist my rib cage on top of my fixed pelvis, as opposed to I can push my leg in but let my pelvis slide back if I'm pushing down with my foot really hard. So in some ways you almost want to keep a little bit of pressure off of your foot, which encourages you to actually push your pelvis in this direction forward as you then spin your rib cage on top of it. Then we're using the proper tempo, that red light, green light idea, pulling in and out of the parking spaces at the end of the motion while keeping that pelvis driving forward, focusing on contraction of my obliques and my abdominals the entire time. At no point am I forgetting that. Keeping them nice and taut and squeezed, which makes it a little bit tough for me to talk the whole time. I'm not trying to force too much range of motion. The only way for me to get over here is for this to fly backwards. So keeping that pelvis, the front bony part of it, pushed forward is what's going to help you identify how much range of motion you can actually operate through before you start losing the contraction, the movement, the intention to move yourself. Twisting. So with it all put together, it might look more like this. Nice and smooth, squeezing through my pelvis, keeping forward and squeezing my obliques and my abs, versus what often happens, and I see this quite often, is people just kind of twist the machine. As soon as you start thinking about twisting the machine, it can happen with anything, versus if I'm thinking about twisting my rib cage on top of my fixed pelvis, engaging my core the entire time. So a couple of troubleshooting things on this machine is if you notice you're feeling a lot of pressure through your spine and your low back when you're doing this movement, if you watch, I might feel a lot of pressure if I'm excessively arched here, or if my butt is not directly underneath my head. If I'm too far forward here, I'm going to feel more in my lower back, or if I'm too far back here, I'm going to feel more back here. So just imagine there's a stick running from the top of your head all the way down, straight through your butt, right down to the seat, making sure we're on that line. And then again, what you can do is if you feel a lot of pressure in your lower back and everything is set up correctly, is you can just do a slight rounding of your lower back here. Not all the way slouched down this way. Makes it hard to get enough motion and to engage the right muscles. But we don't want to be all the way up here super tall. That's going to close off joint space in your spine so you can't rotate as far. But we don't want to be all the way down because that'll do the same thing either. So finding kind of a nice little happy spot. If you don't feel pressure in your back when you're up tall, then do this up tall. But if you feel it in your back, then you can just round that back a little bit and then keep all of those same things that I talked about in place. Another common issue on this one is people start using their hands on these handles in order to move the machine back and forth, because it's easier with your hands to just, especially when things get fatigued in here and you're starting to lose the idea of the intention with which you're trying to move and things are getting tired, so your brain kicks in and goes, let's just move this back and forth as easy as we can now because we're getting tired. What'll often happen is people will start pushing with this hand and pulling with this hand to move it, meaning their chest is no longer staying locked into the pads. So they might rotate well for a little bit, and then at the end when it gets tough, there's this little bit of my chest stops, but the machine keeps going versus keeping that nice and secure on my chest. So if you have a hard time doing that, or you notice your default is often to do those kind of things with your hands, especially when things get hard, it seems to help sometimes to actually just wrap your arms this way. It makes it harder for you to twist the machine with your arms. Some people feel more core engagement when they actually wrap their arms here and take them off of the handles, because the whole purpose of your hands on these handles is to keep yourself pulled into the chest pad so you can twist your chest through the machine as opposed to using your hands to move it. It's harder to use your hands to move it when they're like this. So that might be a good troubleshooting item for you to use if you notice that you're defaulting to your hands or not feeling a lot of core engagement or your shoulders are getting kind of tired. You can wrap up right here with your hands and use those to twist. Another option that has helped some people is actually putting your arms up like this. That makes it impossible to use your hands. And then you can use those again to keep you pulled into the pad and twist through your chest. So there's a couple of troubleshooting options on this machine if you're having issues with it.